One of the things I really wanted to do before the semester was over was to talk to you a little bit about hazards and risk because, first of all, that's what public health focuses on, risk. And you're going to be presenting arguments in your brief for intervening or acting regarding certain risks. So, given that we're always living in a landscape of ever-changing risks and fears, in public health, part of the task is to figure out what do we focus on. I'm just putting some of the risks out in front of you to give you a gentle reminder of just how risk pervades our contemporary world. And again, the question there is, how do we know what risks to focus on as experts? And how do we know what risks to act on? And we can ask the very same thing of the public. The public listens a lot to experts, but also has its own attitudes and perceptions about risk. So we'll take just a little walk through some of this. Basically, you want to make sure you're comfortable with the difference between hazard and risk. We talked about this a little bit in class, but certainly hazards are the bad or destructive things that can happen. But risk is what can happen to you or your community because of the hazard. So if you live in an environment that is a food desert, you are at greater risk for becoming obese. So I think everybody's pretty comfortable with that, but keep those two terms clear in your mind. And then, so if you think of hazards or the sources of these bad things and harms that can happen, it's everything from new viruses and pandemics and earthquakes and terrorist attacks, and the consequences to us are diseases that we are at greater risk for. So, again, how do we judge what to be concerned about? How do we stay sane and go about our daily lives? Something that you have to factor in to approaching risk communication from a public health perspective. So that, close to 400,000 people a year die from smoking, but 300 people will drown in their bathtubs. 1,000 people will even choke to death on food, and 20 to 40,000 in the U.S. die every year of flu alone. And yet, the perceived risks of these four things is quite different. So what is acceptable risk, and can we know what is a risk now versus what will be a risk in the future? So just again, the people who study risk are social scientists who study people's attitudes and perceptions of risk, scientists who are looking at the scientific evidence, the epidemiological evidence, and a lot of you are going to be arguing from the epidemiological alone, and I want you to expand your understanding and appreciation of the risk that you're talking about, because there are other ways to see it from a social scientist perspective, from a political scientist's perspective, sociologically, anthropologically, and certainly from a communications point of view. So, who defines what is risk? Experts, societal norms themselves, the media for sure, other key influencers and leaders who may not be experts, people in community. So risk is in part a social construct. In other words, our social embeddedness, our social relations, the context of our social lives can define risk for us. Risk is knowledge and consent. They're tied together very importantly, because if we consent to something knowingly, we perceive it less as a risk. Whereas if we are exposed to a risk against our consent or without our consent, we often have more sense of the hazard of things and the outrage. Peter Sandman had created some categories of ways to think about how the public perceive risks, so that if it's a voluntary risk versus something coerced, it's less risky to me. I might downhill ski and not see too much risk in it. But if I were to tie some wooden sticks to your feet and put you down an icy hill, you might see it as very risky. If something is natural or man-made, like a storm, or familiar, it's generally perceived as less risky, as opposed to something that is man-made or industrial or very exotic or very dreaded. Same thing with chronic versus sort of something catastrophic. And certainly something that is knowable is less risky, perceived less risky than something that is unknown or ambiguous in its meaning and its risk. And again, for things morally charged, if trust is betrayed. So again, the idea that risk is not just this clear-cut epidemiological black and white reality. And I want you to keep that in mind as you argue for whatever actions or interventions or directions you will in your brief. So understanding risk involves competing risks, changing science. Are we assured that something that we perceive as a risk now or identify as a risk now is not going to change with more evidence? And are there changing cultural perceptions of risk? Certainly we know there are. And risk is highly charged. It's not an emotionally neutral element. And the public can essentially clip off and become almost overwhelmed with a risk. There are many approaches to tackling or communicating risk. Logic versus emotion, scaring people, focusing on the negative, focusing on the positive, doing a risk-benefit analysis, and a whole range of other emotional appeals. These are all different ways to approach risk. And some things work in some situations and some in others. So in other words, a logical, educational approach may work with a certain risk and be an entire failure with another one. So this Hep C ad uses, a grotesque visual image that shocks and is memorable to talk about what Hep C might be doing inside your body, inside your liver. And if you could see it on the outside, perhaps you would realize the devastation of it. We really don't have solid evidence one way or another that says categorically scare tactics work in communicating risk. And I think that's important to keep in mind. What we do know is framing risk and how we frame it makes all the difference in the world. That we do need to understand more about people's current conceptions and cultural models for risk. And we have to tailor risk messaging to those frameworks that people use, to their health literacy. We have to be a trusted source of information. And certainly we have to be linguistically and culturally appropriate. So risk communication is a whole field on its own. Keep that in mind as you are presenting your evidence for the risks that you're focusing on, that there should be a range of strategies you use in talking about the risk. Don't let the numbers alone lead your argument. Imagine that the brief that you are creating is for a mixed audience, perhaps of people on a city council or a community board, with varying degrees of understanding of science and epidemiology, and making their own decisions about risks and benefits, and what risks are worthy of focusing on and what risks aren't. Also be cognizant of and respect the discussions around the uncertainty of certain risks. Don't make everything sound as though we know this about the risk, this is categorical, and there's no ambiguity. If there is uncertainty, by all means bring it up. And I'll leave you with these few guidelines. Know your audience, or imagine your audience. Define that audience in the beginning of your brief. Speak in language that is clear and understandable, not meant for technicians or high-level scientists. Be mindful of your messaging around the risk, and provide enough information in this brief to leave people trusting you and feeling that they could manage the information that you've presented on their own. Be aware also that just talking about disease rates is not enough, that there are other kinds of evidence that you should be trying to bring in, and if there is evidence about a public's perception of the risk, or how a public has reacted to a risk, that's rich insight that a brief can present. And of course, when there is disproportionate risk, to include that, as it is very important. Just to give you an idea again of changing norms around risks. Smoking back in the 30s was recommended by doctors. Fast forward to the late 70s, early 80s, smoking was synonymous with the great outdoors and the cowboy. And then as the 90s came along, smokers were relegated to the margins of society. But it took 50 years. So we do live in an ever-changing landscape of fear and risk, and a very black and white public health model of appreciating the richness of hazard and risk is something I want you to guard against. That see the strength of the data, but understand that evidence about risk should include more than just what the epidemiologic or biologic data is. Anyway, just thoughts for now. I'm actually going to in the completed outline that I sent you for the brief, point out some issues you could raise when discussing the literature that you've reviewed. All right. Talk to you soon.